Hi everyone, welcome back to my YouTube channel. Thank you for stopping by. Today I will be talking about 2021 core set of children's healthcare quality measures for Medicaid and CHIP, which stands for Children's Health Insurance Program. I will be going over measure steward, measure name, and their data collection method. So first category is primary care and preventive care. The measure is weight assessment and counseling for nutrition and physical activity for children/adolescents. And what is measure steward? A measure steward is an individual or organization that owns a measure and is responsible for maintaining the measure. So the measure steward for weight assessment and counseling for nutrition and physical activity for children/adolescents is NCQA, and its data collection method is administrative, hybrid, or electronic health record. Second measure in this category is chlamydia screening in women ages 16 to 20, and the measure steward is NCQA. The data collection method used for this measure is administrative or electronic health record. Next measure is childhood immunization status, and the measure steward is NCQA. We use methods like administrative, hybrid, or electronic health records to collect data for this measure. Next is screening for depression and follow-up plan, ages 12 to 17. The measure steward is CMS, Centers for Medicaid and Medicaid Services, and the data collection method is administrative or electronic health record. Well child visits in the first 30 months of life, the measure steward is NCQA, and we use administrative method to collect data. Next on the list is immunizations for adolescents. The measure steward is NCQA. We use administrative or hybrid methods to collect data. Developmental screening in the first 3 years of life. The measure steward is OHSU, which stands for Oregon Health and Science University. The data collection methods are administrative or hybrid. The last for this category is child and adolescent well care visits. The measure steward is NCQA, and we use administrative method to collect data for this particular measure. Next category is maternal and perinatal health. The first measure in this category is audiological diagnosis no later than 3 months of age. The measure steward is CDC, which stands for Centers for Disease Control and Prevention. Electronic health record is the data collection method. Live births weighing less than 2,500 grams. The measure steward again is CDC. State vital records is the data collection method. Prenatal and postpartum care, timeliness of prenatal care. The measure steward is NCQA. Administrative or hybrid is the method that is used to collect data for this measure. Contraceptive care, postpartum women ages 15 to 20. OPA is the measure steward, and OPA stands for U.S. Office of Population Affairs. Administrative is the data collection method. Contraceptive care, all women ages 15 to 20. OPA is the measure steward, and administrative is the method to collect data. Low risk cesarean delivery, or LRCDCH, it has 4 asterisks, which indicate that this measure replaced the PCO2 cesarean birth measure in the 2021 child core set. To reduce state burden and report a cesarean birth measure consistently across all states, CMS will calculate the LRCDCH measure on behalf of states using National Vital Statistic System natality data that are submitted by states and obtained through CDC wide-ranging online data for epidemiologic research starting in federal fiscal year 2021. Now, the measure steward for low-risk cesarean delivery is CDC, and state vital records is the data collection method. There are two categories on this slide. First is care of acute and chronic conditions. The first measure in this category is asthma medication ratio, ages 5 to 18. NCQA is the measure steward. Administrative is the data collection method. Ambulatory care, emergency department visits, the measure steward is NCQA, and data collection method is administrative. The other category on this slide is behavioral health care. First measure is follow-up care for children prescribed attention deficit / hyperactivity disorder medication. This measure is part of the behavioral health course set. The measure steward for this measure is NCQA, and the data collection method is administrative or EHR. Follow-up after hospitalization for mental illness, ages 6 to 17, the measure steward is NCQA. Administrative is the data collection method. Metabolic monitoring for children and adolescents on antipsychotics. This measure is part of the behavioral health course set. The measure steward is NCQA. Data collection method is administrative. Use of first-line psychosocial care for children and adolescents on antipsychotics. This measure is again part of the behavioral health course set. The measure steward is NCQA, and the data collection method is administrative. We have two more categories left to talk about. So the first category on this slide is dental and oral health services. And the first measure in this category is percentage of eligibles who received preventive dental services. The measure steward is CMS. Administrative form CMS 416 is the data collection method. The other measure is sealant receipt on permanent first molars, and it has 5 asterisks next to it. And these asterisks indicate that this measure was added to the 2021 child course set. It replaces the dental sealants for 6 to 9-year-old children at elevated caries risk measure, which was retired by the measure steward. The measure steward is the DQA, and administrative is the data collection method. The other category is experience of care. The measure is Consumer Assessment of Healthcare Providers and Systems, or CAPS, Health Plan Survey 5.1H, child version including Medicaid and children with chronic conditions supplemental items. The measure steward is AHRQ, which stands for Agency for Healthcare Research and Quality. Survey is the data collection method. On this slide and the next slide, I have pasted legend to provide you with additional information and clarity. Here you can see various acronyms that were used in this video and what they stand for. I conclude my presentation with the reference slide. Hope you found this information helpful. If you enjoyed this video, please consider subscribing to my channel. Thank you for watching. Bye now.